everybody. Welcome to the last session of the day. My congratulations to you for all turning up. I'm Martin Keenan. I'm a consultant nurse from Southport and Ormskirk. I'm grateful to CareFusion for sponsoring this session. I'm chairing the session, but I'm also the first speaker. My background is infection prevention and control. I've been doing it nearly 22 years now. I'm a member of the Department of Health's Advisory Committee, RHI, and I'm the immediate past president of the Infection Prevention Society. I used to be the Infection Control Nurses Association. And I really want to talk about surgical site infection for the next 15 minutes, and I'd ask you to hold on to your hats. This is a bit of a rushed presentation, but if anybody wants a copy, my email address is on the bottom, and if you'd like to drop me an email, you're very welcome to have it. Okay. So, we have a certain amount of surveillance that is mandatory in England. There's more surveillance that's mandatory than all the other countries of the United Kingdom. Apart from a relatively small amount of surgical site infection surveillance, we also, as you know, have to count MRSAs and C. diffs. MRSA bloodstream infection started in 2000, and when we started counting it, the numbers went up and up and up. C. diff started in 2001, and you guessed it, the numbers went up and up and up to quite a staggering level. In fact, by 2006, C. diff had hit nearly 56,000 cases in England, which is quite scandalous, I have to say, and probably should have been classed as a public health emergency at the time. About that time, the Infection Control Team's office generally looked a bit like that in most organisations. Where we try and sell people, not only sell people a paddle, but also give them some information on how to paddle the canoe for them, as opposed to the previous method, which always seemed to be, you bring a paddle and paddle the canoe for us, which is not really the way we're going to go about it. Now, of course, numbers have come down dramatically, and the media don't, of course, report this anymore. The Department of Health publish figures every so often, and nobody takes any notice of them because they go down.